The privacy and security fence the city proposes, which will be not private or secure.
Thank you. Dorothea Barrow.
Good afternoon and Happy New Year, council members. The last 2 times I stood in front of you late last year, I wore my green hair and green glasses to bring awareness to the atrocities and disparities that plague the vulnerable and underserved, severely mentally ill and intellectually disabled community. Now I am adding autism spectrum disorder to this cause. I represented my grassroots mental health advocacy and awareness organization, Midaana'S Voice, founded in 2022 based on the principles of Proverbs 31:8-9. Today in this new year, I stand in front of you as a mother and a healthcare power of attorney without green hair and green glasses, today that is. I have 2 grown children, a beautiful daughter that has a master's degree in social work and is a licensed clinical social worker. I have a wonderful 28-year-old son with special needs of ADHD, severe emotional disability, borderline intellectual disorder, pervasive developmental disorder, which now falls under the umbrella of autism spectrum disorder. My son also suffers from comorbid mental illnesses, one being schizophrenia. I have gotten my son the mental health help he needed since he was a child through outpatient mental health agencies with ACT-assertive community treatment teams. My son had an IEP in school and had SSI and Medicaid. When my son turned 18, I obtained healthcare power of attorney over him. My son has been in and out of mental hospital wards and units since he was a kid, so his mental health track record is very well documented. Even with all the health services my son received throughout his young life, near tragedy still struck and he still fell through the cracks of the broken mental health system at the hands of NCG Care Carolina Outreach ACT team in Raleigh, North Carolina, across the street from Holly Hill Hospital. This ACT team of a psychiatrist, nurse, therapist, and other quality professionals such as a psychosocial rehab specialist claim to visit my son twice a week. They were the dangerous ones who caused harm and danger to my son and have yet to be held accountable. A female member of the ACT team who knew my son for 3.5 years failed to follow protocol and procedure when it came to mental health crisis of psychosis and nearly caused his demise. My son, who lived alone in supportive housing in Raleigh, funded by Alliance TCL Transition Community Program, was neglected by the ACT team who failed to intervene when my son was in a mental health crisis of psychosis. The team told me to my face that my son was decompensating. The team failed by not IVCing my son for his safety and to prevent harm and danger. The emergency rooms, hospital, psych wards failed to prevent proper treatment and care to prevent harm and danger, and even my son asked for asylum. It was not my son who was dangerous. It was the entities within the broken mental health system who were dangerous. My son never had a criminal record before, never did drugs or alcohol, and he is not for the streets. He is quiet and keeps himself, so end the stigma. You cannot reform the mental health system if there is poor oversight of these mental health agencies and hospitals and no accountability. So we need to do something with the mental health crisis and getting our loved ones the help they need in a timely fashion to avoid harm and danger. I am Midaana'S Voice, the green-haired lady, a.k.a. Dorothea Dix 2.0, Justice for Free, MNB 4K. Thank you.
Thank you.